it going? This is Steve from Telnyx, and today we're going to do a little demonstration of a mental health behavior coach AI assistant that we built here. So without further ado, let's hop into our assistant setup screen here. So we'll go and edit this and we'll take a quick look through what we've done. To get this rolling, all you have to do is give it a name. Choose any one of our 35 LLM models. If you're choosing any private models, you'll have to provide your API key through a separate integration secret. And then you just go ahead with adding in your prompt. Make sure you follow good prompting guidelines. We'll have some materials to help you there as well if anything pops up. But this guide here is just really around helping folks that are feeling a bit off, feeling a bit odd, not really sure what to do. And we're going to be able to try to address those concerns, coach them along if we need to, and be able to support follow-ups. We have our greeting that's configured here as well. Please take note, this is a healthcare use case and we don't want anyone to give us any private information, so we have a little bit of a disclaimer there. We've also set up some of our tools here, so we have a retrieval tool to be able to find information that has been uploaded and embedded into a storage bucket. So you can find your buckets over here as well. I'm going to take a peek here to find any of the objects that have been uploaded. In this example here, we have added a number of different resources which can be provided to users after the fact over a text message if need be. You can also go ahead and set up webhooks to be able to reach out to external systems over API to find information about patients, other connections that can be done, and even transferring calls if the bot needs to do that as well. So without further ado, let's give it a call. I can do that just by clicking on this call button here.
Hello, and thank you for contacting the Mental Health Resource Center. This assistant is to be used solely for demonstration purposes, so do not provide any private or privileged information. My name is Jessica. Can you please tell me your name and how I can help you?
Hi Jessica, my name's Bill. Been, feeling a little bit stressed out lately.
Hi Bill, it's nice to meet you. I'm here to listen and support you. Stress can be tough to deal with. Would you like to share a bit more about what's been going on or how you've been feeling lately?
Well, I'm trying to learn as much as I can about AI, but I just feel constantly behind.
It's understandable to feel that way, especially with something as vast and rapidly evolving as AI. It can be overwhelming to keep up with everything. Have you noticed any specific times or situations when these feelings of being behind are more intense?
Not really. You know what? Is there any organization or anyone you can put me in touch with that I can get some more information about how to deal with these sort of stresses?
I found a couple of resources that might be helpful for you. 1. Crisis Text Line. You can text HOME to 741741 to connect with a trained crisis counselor. They can provide support and guidance for dealing with stress and other challenges. 2. National Grad Crisis Line. This is a resource specifically for students and learners who might be feeling overwhelmed. You can reach them at 877-472-3457 or visit their website at gradresources.org/crisis, https://gradresources.org/crisis. Would you like me to send this information to you via text or email?
No, I wrote that down, but thank you so much, Jessica. Goodbye.
You're welcome, Bill. I'm glad I could help.